Hi, I'm Cassidy. I'm the respiratory therapist. I have an order to intubate my patient. I'm going to check the chart for the order and any contraindications. There are no contraindications for this patient. I'm about to enter the patient's room, explain the procedure, identify my patient, and ask him a few questions. I'm in the patient's room. Hi, I'm Cassidy. I'm your respiratory therapist. We're going to intubate you today, which is putting an E2 tube down your throat to help you breathe better. Can I get your name? Jimmy Joe, and your date of birth. Thank you. I'm just going to ask you a few questions to kind of assess how easy this procedure is going to be. Can you open your mouth for me? Okay, this patient seems to be a Mallampati of 1, which means the procedure should flow easily. No facial hair is noted, which also eases my procedure. I'm going to step out of the room to wash my hands. Becky is my assistant. She's going to ventilate my patient to 100% oxygen before we get started. I'm washing my hands. I'm back in the patient's room, gloving. And protective eyewear. Upon entering the room, I'm assessing all my tools. We have an extraglottic device, which is an LMA, just in case our procedure fails. I have a syringe, presets of 5 cc's of air to inflate the cuff. I have an E2 tube with a stylet. I have a Macintosh blade with a fully functioning light. I have means to secure my tube. I have an assistant ventilating my patient with an ambu bag and a CO2 detector. Also my stethoscope to auscultate placement. We also have suctioning equipment if needed. We're going to wait until the patient gets to 100% oxygen to get started.
Okay.
100%? Okay. We're going to begin the procedure. Entering the mouth, making sure I do not ride back on the teeth, visualizing vocal cords, inserting the E2 tube, removing my stylet, my assistant is holding my tube and my gloves. I'm going to insert 5 cc's of air.
Or at 22.
22 at teeth. We will measure the cuff pressures later. 22 at teeth is ideal, so we're not going to move. I'm going to auscultate.
Color change at the CO2.
Color change CO2. Also, second method for placement. Bilateral breath sounds with no epigastric sounds. Securing our tube. Okay, we have a cushion at the lip. I'm going to listen one more time after I manipulated the tube. Alright, still bilateral breath sounds with no epigastric. We're going to order a chest x-ray.
And check cuff pressure.
We noted that we will check cuff pressure. Alright, we're going to continue to monitor this patient and set him up on the ventilator.